And I'm Lisa.
And this is the Paid Media Playbook, where we talk to marketing professionals about their challenges, tactics, and triumphs.
Join us here at Double Z Media for weekly conversations about media strategies for marketing leaders.
Welcome. Today we have Dr. Arif Khan from Northwest Clinical Research Center with us. And welcome, Dr. Khan.
Thank you very much. Pleasure to be here.
Well, we're going to talk a little bit about marketing today, but first we want to hear a little bit about your background and how Northwest Clinical Research kind of got started and how you got started.
Okay. So I was born in post-independent India, 6 years after independence.
Mm-hmm.
So ancestrally, our family was all landlords, agriculture. But my father had moved to big city, then Bangalore, and so he had a degree in engineering, and he was involved in state government. So when I started schooling and college, obviously my interest was chemistry and biology, so medicine was an obvious choice. So medicine at that time, most of the physicians and medical schools were not training into research, partly because India had missed on the industrial revolution. But I certainly was interested in looking at new ways and developing things and developing new ideas. Because when you serve a group of patients, you only serve a group of patients. When you do teaching, you multiply that by a factor of 10 to 100. But when you do research, you multiply in hundreds of thousands to millions. So that's what,
Right.
what always that's interested me. And so when I finished my medical school, I came to the US. There was some in between, but came to Connecticut, University of Connecticut, did my postgraduate work, what's called a residency here. Then I came as a faculty to University of Washington. Well, 40 years ago, 41 years ago. Was there for about a decade, something. And then academics, you cannot completely focus on research. I know it sounds paradoxical, but the problem is you have administrative duties, you have teaching duties, you have all kinds of other things. So we decided, my wife and I, she's a psychiatric nurse, that we'd be pursuing more research career. So we started off in Kirkland in 1995 with one trial with a medication called Effexor for a new indication. And then we kept on heading. So with the 30 years, we've grown to have about a dozen physicians, plus lots of master's level clinicians and all that. So we do a lot of clinical trial research. We work with big companies like Johnson & Johnson, Pfizer, Eli Lilly, just to name a few. And so we are sort of independent contractors with them, and we work with them to help develop new medications. As of now, in the last 30 years, we've been involved in medication research, out of which about 48 medications have come into market.
I guess a huge part and how we came in to know you is by helping recruit patients for clinical trials.
That's where we come in. We do the field testing.
Field testing.
Field testing essentially is basically to make sure that this drug is not going to harm people.
Mm-hmm.
Do no harm is the first principle in medicine. So that's what we follow, and that's what we do. We do a lot of testing. We do a lot of general evaluation to see if any sort of medicine that we're looking at makes sense for the person. So, knowingly, you're not going to expose somebody to unnecessary risk. So you have to establish that. That's what we call screening. That's why we recruit a lot of patients.
Right.
Because we need a lot of volunteers, and it's important to say that in Seattle there's a lot of interest. The public is well educated, they understand medical research, they volunteer, and altruism is one of the key things that drives them. So once they do volunteer, we assess them. It may take a day, it may take a month to make sure that all the things across. It depends on the indication,
Mm-hmm.
how long the trial is, and whether it's X-rays and blood tests, all that. So then you look at basically some people get the medication, some people get a controlled substance, either medicine that's controlled that's already
Mm-hmm.
used, or most of the ones we do are placebo or are drugs that look either the solutions, injections, pills, capsule that look like the actual drug.
Mm.
Then you study the effects, and then you measure what the good and bad points. Okay, then for say for example, if you want to get a new blood pressure medication,
Mm-hmm.
usually there are about 5 to 6,000 patients exposed to it. Control group is about 3 to 5,000, and another maybe 3 to 5,000 with the treatment existed. So it takes about say 8 to 15,000 patients around the country.
Now, it's my understanding that you've had a great record of zero fatalities,
Yes,
and that's terrific. I mean, obviously, it's pretty vetted at this point, but people really have nothing to worry about because you have like this perfect record.
yes. By the time they come and we experiment and the things we have done in the last 30 years, we never had a fatality related to any drug. It just hasn't happened because
Right.
the FDA, even though there's a lot of criticism as a federal agency, is
Mm-hmm.
extremely strict and they monitor so closely. I mean, patients do die in trials, like Alzheimer's disease.
Mm-hmm.
They do
Well,
die.
yeah, that makes sense. I mean,
Yeah,
natural causes type of
natural
thing. Yeah.
causes happen.
Yes.
People have accidents and die, and
Mm-hmm.
that sort of thing. But something related to actual drug toxicity, I haven't seen in 30 years.
So, question from a marketing standpoint, what was the toughest trial to market, you think, like to get people recruited in for? What is the most difficult to find people for?
I mean, that's sort of the easiest. Easiest are things like, high blood pressure, depression,
Weight
or
loss.
migraine headaches. Weight loss is extremely popular. We have people are just on waiting lists. We just don't have enough medicines or enough slots to do for weight loss drugs. But the most difficult is that one of the difficult issues within the society itself, because most of the drugs that are approved for adults, most of the testing gets happens in adults. So the old, trials that happened a while ago, the same medicines were given to children, believing that they are small adults. But the problem is that they're not small adults.
Mm-mm.
They're metabolized very differently. So if you go back and look at your old Tylenol or aspirin, it said there's no research on children, below the age something. Talk to your pediatrician, but your pediatrician doesn't know. Yeah, he or she has never been told. So in '97, FDA passed a rule saying that all medicines that could be used for children that have approved for adults should have some testing done. So in the beginning, there was a lot of interest in it, and we used to get those are the hardest trials to recruit for, adolescents or even
Mm-hmm.
8-year-olds. But as time has gone by, and there's been a sort of an anti-vaccine movement and
Mm.
research movement, and certainly the social media has made it very difficult because I'm not saying that they're not horror stories, but that just sort of influences. So
Mm-hmm.
recruiting for these trials, which are very critical because you don't want to give your kid the medicine that's never been tested. But if you don't volunteer, how can you know? You know what
Right.
I mean? So it's a sort of a dilemma in our field.
Yes. Right.
How do you prescribe for children? So in fact, a lot of the prescriptions of children have gone down, certainly psychiatric medications and such things, simply because the pediatricians are just too nervous to
Ah.
prescribe.
Can we talk at all, Dr. Khan, about the trial that we're trying to do right now for autism, ADHD, like some of that stuff?
Yeah, like I said, these are the medicines that are already in the market and that are being used, but not extensively in children. And they
Right.
should work, but there's not enough information. So that's why we are looking at how to recruit patients, certainly in the general media, because social media is not very effective in that. So we have, 30 years ago, 40 years ago, you put a small 3-line ad in Seattle Times or Seattle PI, you got 30 or 40 patients signed up. And then it went to radio, then TV.
Mm-hmm.
For the last decade, I would say it's pretty much social media.
Yep.
And social media, it's various forms, but certain conditions like pediatric studies, social media, there's so much negativity that it doesn't work as well.
That makes sense. I mean, I get it. It's become kind of political, which is
Yeah,
unfortunate. And then so you get mixed up in that and they see it through that lens, right? Yeah, that makes sense. Yeah, I know because we're trying to talk to the parents. You got to come at it from places that are of trust, of true,
yeah. But
like,
also the other problem is that in Washington State, if a school knows the problem that one of the students is autistic or
mhm.
has got a mood disorder, they cannot diagnose it or say you should get this tested. You know why?
Why?
Because the school budget will have to pay for the management and treatment. They can say go get a testing, don't make the diagnosis.
Just don't.
Um,
Yeah, that's a good point. Okay.
So you can. That's why when you whoever you're talking about,
Mm-hmm.
they said go get it tested. We don't know. So
Right.
if they say that's why, in terms of recruiting to schools, school counselors is very difficult because once they sort of say, hey, we think this is the problem, then the parents and all the advocates say the school budget should pay for it. So that's why we got to go to, for recruiting pediatric patients and families, a media which is hopefully not too biased.
Yeah, that is interesting. You can't go through the schools. So yeah, we are faced with that challenge right now at Double Z. So we
Mhm.
are helping you recruit right now. So it's
Okay.
a challenge. It's a challenge, but we're up for it. Lisa, do you have the final question for Dr.
Yeah.
Khan?
So, Dr. Khan, if you could go back in time and give yourself at the beginning of your career one piece of advice, what would it be?
I think I told you last time, be humble, right?
Yes.
Yeah. It's easy to get carried away, but yeah. I think it was John Kennedy who said, even as you have to put on pants one leg at a time.
Well, thank you so much, Dr. Khan. This has been great. And if you want to reach Northwest Clinical Research, you
Is NWCRC?
Main one, nwcrc.net. And the phone number is 425-453-0404.
awesome. Well, thank you so much. That'll also
Thank
be in
you.
the show notes. So you'll see it there. Thank you so much, Dr. Khan. We hope to talk to you soon.
Thank you.
Thanks for listening to the Paid Media Playbook. Want more content like this? Follow our agency, Double Z Media, on LinkedIn. You can find the link in the episode description.